Jo, I don't want to make this about the Lucy Letby case because we've gone over this multiple times now. But when it comes to the NHS, it is almost like a religion, to the point where we even had a church service for it the other day. And if you try and criticise it in any real way and you say it needs proper reform, there's a huge amount of people out there that get deeply offended. But I worry about this, and I worry about whether or not we're just getting so emotionally attached to the concept of the NHS that we're perhaps not seeing it for some of its flaws and for what it perhaps really is.
Well, I think one of the things, without talking about the Lucy Letby case, but actually one of the flaws that came absolutely loud and clear throughout the trial was the failure of management. And I think the problem with the health service is that when we are rushed into hospital or, you know, we are in dire need, we are in a vulnerable state, so therefore we are grateful. And while most people would not criticise the actual health professionals in most cases, when you have incidents not as extreme as this one, but, you know, the failure of East Kent Hospitals Trust, for instance, the failure of maternity services, the failure of Bristol Children's Heart Hospital, over the years, we've seen failure after failure after failure. And what you've got is a fragmented organisation where people cannot or will not sort out the IT that allows information about patients to be exchanged properly. So it's very difficult to know who to complain to, because I think when people, you know, I'm sure the viewers will say, yeah, I've had bad experiences. But most people say, no, the people who looked after me were absolutely brilliant, which they are. What I think most of us, and where the problem lies, and this is the rosy tintedness, is if you make a complaint about, oh, I don't know, administrative errors on outpatients appointment or something like that, or possibly care, you will get a bland response, if indeed you get a response, from somebody in middle management who will, you know, talk to you about your mission statement and values. And I think that's the problem. It's so fragmented, but it is completely and utterly dysfunctional. If it was a company, it would need to be closed down and started all over again.
See, I was looking at this today, and do you know how much was spent last year in negligence?
In fighting negligence claims?
Yeah, so in terms of the negligence that was spent by the NHS, do you know how much money there was?
Couple of hundred million?
No, £13.3 billion.
That's unbelievable. That's 10% of the budget, nearly.
Yeah,
That's
£13.3 billion was spent on negligence claims. Apparently, maternity claims made up 60% of that figure.
Which is awful.
Yeah, it goes on. It goes on to say 13,551 clinical claims were received by the NHS in 2022-2023. The number of claims that reached some sort of settlement was 13,499, so almost all of them, quite frankly. And then I was looking at the King's Fund study. Out of 19 countries that they assessed, the UK has got the lowest levels of life expectancy. We've got below average health spending. We lag behind other countries in terms of capital investment. We've got lower levels of key clinical staff, so they say, and I could go on.
Yeah, I mean, it's... First of all, I'm not sure that we do put the NHS on a pedestal. I just want to look at that for a second. I think it's the politicians who put the NHS on a pedestal.
We had a church service for it the other day.
What the electorate, I think, put on a pedestal is the principles of the NHS. In other words, that it should be state-funded and free at the point of delivery. And anyone who messes with those two principles, I think, comes under severe attack from the electorate. I think it's the politicians who keep telling us the NHS is this... I mean, like, we had to clap for it during lockdowns.
I remember.
Instead of paying our nurses wages that compare...
And then you've got a government
Canada,
that refuses
US,
to talk to them and refuses to talk to the doctors.
Australia and so on. And so, I mean, I think there's a problem with our politicians and their lack of preparedness to really genuinely tackle the problem, because they now fear criticism from the electorate. And the NHS is therefore getting off, not scot-free, but it's getting off proper scrutiny. That's the first thing. The second thing I just want to quickly say on the Lucy Letby thing, if I may, is that together with this diversity and equality and inclusion comes an inclination in organisations, and the NHS is subject to DEI, diversity, exclusion, equality and inclusion, just like any other organisation. With it comes a preparedness to cloak failure for fear of upsetting the individual who's being ticked off. Accountability is going out of the window because we're too frightened of upsetting people with whom we're interacting and whom we have to manage. And Lucy Letby, I was speaking to an ICU nurse over the weekend, and she said it's unheard of that a baby dies in ICU. For 7 babies to die, and for 7 nearly to die, just boggles the mind.
Yeah,
and
it's not unheard of. Babies do very tragically die.
Yeah, but 7, well, it's
rare. Yeah,
it's
the
very
rare
rare.
Thing.
And for 7 to die and 7 to nearly die is just absolutely boggles the mind. And I think what's happened is there's a disconnect in the organisation for multiple reasons, some of which I've touched on, and a lack of preparedness for people to really challenge it. So the answer is nothing should be on a pedestal. We should really tackle the problem of the NHS. The NHS needs radical reform. Some of the reform it needs is because it has in the past succeeded. You know, the average life expectancy in 1948 or whenever it was that it came into being was 68. It's now 81. That is a sign of success in our health service. But, of course, it creates a much bigger burden. And, of course, we've got many more people in the country than we used to have. We've got lots of immigrants coming in. Just to go back to that point, I want to drive it home. That puts a burden on the NHS. And so we've got to look at...
A lot of people would say that without those immigrants, because actually a lot of people would say that a lot of the NHS staff now are those immigrants, so immigration is...
But I would say that we've driven out a lot of the staff that would have been here because we're not paying them enough and we're overtaxing them. It comes back to this very simple principle that it should pay to work and you should be allowed to keep your legitimately earned money. And we are too high on tax. We saw 7,000 ambulance workers leave the service last year, as I mentioned already in this programme. We saw 500,000 young British citizens leave the country last year. We're going to see a brain drain if we don't get a grip of creating aspiration in this country.
And there is a huge amount of sick leave as well when it comes to the NHS, particularly, I think, in the ambulance services that you were mentioning just there.